Welcome to As a Woman, Fertility Hormones and Beyond. I'm your host, Dr. Natalie Crawford, and I am a board-certified OBGYN and fertility physician, and also co-founder of Fora Fertility in Austin, Texas. Each week on this podcast, I discuss health and fertility and how they relate to your true self. Become a part of the community of collaboration that amplifies others as a woman. I hope you enjoy the episode. Hello and welcome to the As a Woman podcast. I'm your host, Dr. Natalie Crawford, board-certified OBGYN and fertility doctor. Today we are talking all about cycle tracking, which I love that topic. I think tracking your cycle is one of the most important things you can do if you're trying to understand your body and take charge of your reproductive health. And that means even if you're trying to prevent pregnancy or get pregnant, or just see if your body is functioning normally, which is a sign that your hormones are balanced, quote unquote balanced, or working well. Having regular predictable cycles is the outward sign, but tracking them to really try to pinpoint when ovulation occurs is going to provide you much more data. And it's something that I think is especially important, especially in the time we're living in right now with political uncertainty over what may happen to reproductive care access or birth control or family planning options. I think knowing and understanding these options are really, really critical. Before we jump in, I just want to give a few housekeeping items. Number one, this podcast is fantastic and it's all because of you guys. So thank you so much. I appreciate all your support and I appreciate you powering through some of the ads, which allows me to now help have a team getting the podcast to you. Number two, a lot of the questions come from you guys, and that is so helpful because I can see what questions you have, and that really is guiding the content. There are going to be some podcast changes in 2025 that I am excited about, but if you have questions, please ask. You can ask on Instagram every Monday at nataliecrawfordmd. There will be a question box, and you can pop your questions in there. Some will be answered on Instagram, some will be answered here on the podcast, some will be answered in the weekly newsletter. You can sign up for the newsletter at nataliecrawfordmd.com/newsletter. It has recipes, sharing some of my favorite things, discount codes, friend products, updates on reproductive health, and does have Q&A. So it's not spammy, really trying to give you another medium to help understand your body, your fertility the best. And you can also call and leave a voicemail. So 657-229-3672 is the As a Woman voicemail. Voicemail episodes are my favorite. So 657-229-3672. Call and leave a voicemail with whatever question you may have. Now with that, we are going to dive into this episode. Again, huge thanks to all of you. Now, of course, any discussion about natural family planning is going to have a few caveats to it. And of course, with specific methods, I will tell you what those are. But the first is going to be an understanding of your cycle. You have to understand what is happening in order to understand how we use these different methods. Number two, going to be much harder if your period is irregular. Doesn't mean it's a no-go. For some methods, it will be, but it's going to be harder. And if you are on hormonal birth control or you're taking hormones, you can't track your cycle with natural family planning or what we call fertility awareness methods. That's because you are changing your hormones. You might be changing parameters that we're checking. If your doctor has told you to take estrogen or progesterone, you should follow your doctor's advice, but just know that it's going to influence what we're talking about. A great example of this that I hear all the time, and we'll dive in and go through it, but estrogen rises as you grow an egg. And as you go through IVF, you have more eggs, more estrogen, higher. And so patients who are very familiar with tracking their cycles will freak out that suddenly they have all this cervical mucus or these other signs prior to their egg retrieval, thinking that they're ovulating. And they're not. It's because they have high estrogen. It's just happening at a different time because we're manipulating things with IVF. So please understand that if we're giving you hormones, if you're doing fertility treatment specifically, we are changing things. So these methods may not be as accurate or may not be accurate at all. Very brief cycle overview. So remember that at the start of the month, I like to think about a group of eggs all being available. I like to think of them as coming out of the vault. Each egg grows inside a follicle, which is a small fluid-filled structure you see on ultrasound. Now the brain is going to send out FSH, or follicle stimulating hormone, which is a well-named hormone made to get a follicle to grow. As that follicle starts growing, the egg is maturing. As the egg is maturing, it is now going to make estrogen. And that is one of the hallmarks. So if we think about your period or your menstrual cycle, when you're bleeding, when you're on your period, estrogen and progesterone are low. As the egg starts growing, it is now making estrogen. No progesterone, just estrogen. That is the follicular phase. When you ovulate, you are ovulating because your brain, which has no idea what's happening in your ovary, your brain sensed that your estrogen level was high enough for long enough to send out an LH surge. LH and FSH are known as your gonadotropins. They are hormones made from the brain to work on the gonads, or in this case, the ovaries. FSH gets an egg to grow, responsible for estrogen. LH, or luteinizing hormone, is first released in a big surge. When estrogen's high enough, that LH surge pours out of the pituitary gland, and that is the signal for your ovary to allow ovulation to happen. So from that LH surge, follicle's going to rupture. Remember, the follicle is a cyst, it's a fluid-filled structure. It's going to rupture. Sometimes this can be painful. Everybody's growing a cyst in a normal cycle. But that follicle is going to rupture and the egg is going to be released. So the egg's going to come out of that follicle, and then that follicle is going to reseal and form a different type of cyst known as a corpus luteum. Corpus luteum now is structurally different. It has a lot more blood flow. It looks different on ultrasound. But the brain is now going to stimulate progesterone production from the corpus luteum. So a follicle doesn't make progesterone, makes only estrogen. Once you have ovulated, it becomes a corpus luteum. And now, based on LH pulses from the brain, you are going to get that follicle to make progesterone. And progesterone is made in pulses as well. You see this beautiful graph of the menstrual cycle, and you'll see progesterone looks like it's just exponentially rising. And yes, the average of progesterone is rising, and your baseline level is elevating. But you are going to have day-to-day, moment-to-moment differences based on the time you might check your progesterone in relation to when that LH surge was sent out from the brain. So progesterone will rise and fall, but we see an elevation in that baseline level. And progesterone levels now greater than 3 equal ovulation. It is not true that progesterone of 20 is required or that a progesterone of 10 is required. Those numbers tell me you ovulated. But I don't know when your brain is sending out surges. So to act like, oh my gosh, you only had a progesterone of 7, therefore your luteal phase is bad, is not true. And there have been studies done, histologic studies, looking at the endometrium to see if it varies based on these progesterone levels. And it doesn't. And that's helping us understand that we really are having this rise and fall pulsatile progesterone production. On the whole, it is rising. And this changes if you get pregnant. So if you ovulate, the egg should get captured by that fallopian tube, and it can only be fertilized for 24 hours. That's another key in family planning. However, sperm can live in that female reproductive tract for up to 5 days. Now, most sperm, the majority of the sperm's living 1 to 2 days, but it can live for up to 5 days. The egg and sperm, if they get fertilized, the embryo is going to grow and develop to what we call a blastocyst stage, which is a day 5 embryo, and now it can implant inside the uterus. So day 0, day of ovulation, day 1, the next day, first day of fertilization. When the embryo gets into the uterus, if it's going to implant, you're going to get pregnant. Now it is going to be making HCG. And HCG is the pregnancy hormone. That is what you test on a pregnancy test. Super interesting. HCG and LH share a receptor. They're very structurally similar. So HCG now stimulates a constant progesterone production. And it's increasing because in a normal pregnancy, HCG is approximately doubling every 2 days as the embryo is getting bigger and the placenta is getting more established. And in fact, slow rise of HCG or inappropriate rise, which is seen often with abnormal pregnancies, is a signal to the body to make less progesterone to help you miscarry, because humans can't go through lots of pregnancies that aren't going to make it into a baby. So progesterone and HCG are actually a tight communication system. So the progesterone production changes once you get pregnant, because now that corpus luteum is being told, make progesterone, make progesterone, make progesterone, constantly, not at a pulsatile interval. People take that data and then apply it to what a normal luteal phase should be, and that's just not accurate, and that's an important concept as we go through these next few things. If you don't get pregnant, then there is no implantation, there is no HCG. And what is going to happen is the corpus luteum cannot survive indefinitely. It can only survive for approximately 2 weeks. It is then going to collapse and stop making progesterone. So now your progesterone level is going to drop. Estrogen is going to drop too, because it was also made from the corpus luteum. And now you have a hormone drop that your body will sense. You will get a period, a new group of follicles will become available, and the process will start over again. So this is what we consider the menstrual cycle, the follicular phase being the first half, follicle growing, estrogen rising. Peak estrogen is occurring right around LH surging, that is your ovulation. And then in the luteal phase, which is the second half after ovulation, you're now going to have progesterone, where you didn't have it before. You're also going to have estrogen, but you're going to have progesterone. And if you get pregnant, that will carry on. And if you don't get pregnant, estrogen and progesterone will drop and the process will start over. Number one key, if you are saying, I want to track my cycle to prevent a pregnancy. So not to get pregnant, but to prevent a pregnancy. And people do this for contraception, maybe in between children, for a variety of different reasons. And there are a lot of great options for cycle tracking now that include technology. And that is not what we're covering in this episode. I have one of those coming up soon. We are talking about old school tracking. What do you not really need technology, or let's at least say an app or data sharing for? So what can you do without having to do all of that? So what we just reviewed, basic, how does your menstrual cycle work? How do your hormones work? That's important to understand what these tracking methods are. When we think about the different types of cycle tracking and fertility awareness methods, there's cycle tracking, which I really think about mostly as your variety of calendar or days methods. So we'll go over that. And then there are what I say are the fertility awareness methods, more physical signs that your body is giving you about your hormones. Basal body temperature, cervical mucus and position, and urinary hormone testing. I'm going to go over basic LH testing because there are a lot of fancy options out there. As I said, some of the tech's gotten really cool. Most of that is all talking to an app to help interpret it. And the question I am seeing over and over and over and over right at this moment in this political climate is, how can I do this without an app so that nobody knows, just me? And urinary LH testing is easy and affordable, and you can get just those strips. So we'll cover that in what we consider ovulation predictor kits. So let's dive into a few of these. The number one concept is going to be, well, what is the fertile window? Because if you're trying to prevent a pregnancy, you have to know when are the safe days and when are the possible pregnancy days. This is what we know as the fertile window. So because the egg lives for 24 hours, the day of ovulation is considered the last day of the fertile window. And because sperm can live for 5 days, the 5 days before this are also the fertile window. So we usually say the 6 days ending in ovulation. Now, if you're trying to prevent a pregnancy, we're going to go longer, a little bit longer, at least a day longer, because where in that ovulation day, what exact time did you ovulate? And what if you're ovulating earlier this month, but you don't know, and you had intercourse too close to your ovulation day? So what you see is that you have a greater number of days that you should prevent pregnancy. You should abstain from intercourse, use barrier methods, make sure that you are not exposing yourself or your egg to sperm if you do not want to be pregnant. But when we're trying to get pregnant, we are narrowing that down. We know that if I can get you to have intercourse the day that you are ovulating, I can double your pregnancy rate compared to a different day. And this is why methods of fertility awareness can improve your time to pregnancy, so get pregnant faster, and you'll see a much smaller window of days you should have sex versus these days you have to abstain. So one of the knocks or the biggest issues with natural family planning for a lot of people is the number of days you should not have intercourse or you have to use barrier method, because that's not always ideal. No talk of natural family planning would be complete without saying that there is typical use and there is perfect use for everything. You'll see this in any chart. If you Google how effective are the birth control pills, how effective is an IUD, you'll see for an IUD, for example, those numbers are the same because an IUD is in, there's no use variable. So you're going to see a 99% chance of preventing a pregnancy with an IUD. For the birth control pill, you'll see 98% with perfect use. You take your pill at the exact same time within 30-minute interval every single day and do not skip. And then you'll see 93% with typical use. So this means when they study how people use the pill, sometimes they skip a pill or they don't take it at exactly the same time. It has a lower rate of preventing a pregnancy. When it comes to methods of fertility awareness, there is studies for perfect and typical use as well, and we will pull those into the equation. Importantly, nobody is studying, is this better than that? That's not what we're talking about. It can look like that when you hear these numbers, but this is data for you to make an informed choice for what is best for your body. So when it comes to calendar method, we've got the traditional or the simple calendar method. Take your average cycle length, subtract 14 days, which is the average length of the luteal phase, and then that would give you your day of ovulation. You're going to walk 5 days back before that and then call that 6-day interval your fertile window. Those would be the days you do not want to have intercourse. Now, because this is less sensitive and ultimately that's not a very long window, that is not as effective as other methods, but that can sometimes give you a range. I think when you're trying to get pregnant, that can work just fine, especially if you have regular cycles and you know your interval, because it's a pretty narrow window. But if we're trying to prevent pregnancy, the two standard ways are either going to be what's called the rhythm method or standard days method. So in the rhythm method, you are going to observe your menstrual cycle for 6 months. So 6 months before you want to start using this, when you are not on hormonal contraception, you are going to say, here are all my different cycle lengths. Day number 1, first day you start bleeding. The last day is the day before you bleed the next cycle. So you're going to write down your cycles for 6 months. You are then going to take your very shortest cycle and subtract 18, and your very longest cycle and subtract 11. And that is going to give you the range of days you should not have sex, that you could potentially be fertile. So let's say your shortest cycle was 26 days and your longest was 31. You would take 26 minus 18, so that's day 8, and you would take 31 minus 11, and that's 20. And so you would potentially be fertile between days 8 to 20, and you would not have intercourse on those days. The good thing about the rhythm method is that it's taking an average of 6 cycles, so it's a little bit more personalized to the flow your body might have. Bad thing is it could give you a very, very high range of days, but it is going to be a little bit more personalized than what we call the standard days method. The standard days says, hey, if your average cycle is between 26 to 32 days, you can just not have intercourse between days 8 to 19. And you can see based on the one I just gave you of 26 days and 31, how they got to this method. But if your period cycles end up being shorter or longer on average, rhythm would account for that change, whereas standard days is not. So for example, if you have 24, 25-day cycles, you are on average going to ovulate a lot earlier in that cycle. A 24, 25-day cycle, you are probably ovulating closer to day 10 or 11. So if you stop having intercourse on day 8 with standard days, there are 3 days there where you could have had sperm present and could get pregnant. If you were using rhythm method, you would say, hey, 24 minus 18. Oh, I have to stop having sex much, much earlier. But you should see the important definition is that standard days requires a 26 to 32 day cycle. So if you have 24 or 25 day periods, you should exclude yourself. Those are both a little bit more precise than just the simple calendar method, and those have been studied when it comes to preventing a pregnancy. If you want to get a little bit more data, then we can look at fertility awareness methods that are a little bit more specific. So let's talk about basal body temperature. The idea with basal body temperature is that we know your core body temperature is going to increase once progesterone is being made. So we have to know what your OG temp was, and we have to be able to detect when the change occurs. Tech options have made this easier with wearables or connecting to apps to tell you when this is happening with a really specific formula. Again, that's a different episode. If you're OG doing BBT, you are going to get a specific thermometer for basal body temperature, has to have 1/10 a degree of sensitivity, and you are going to use this every single morning before you get out of bed. Before you drink water, check your phone, go to the bathroom, have sex, any of those things needs to be around the same day every morning. Some of the issue here is that if you miss a single day, you might not see when the shift is happening as well, or your temperature is influenced by other things. If you're sick, if you drink alcohol, if you don't get good sleep. So once you have ovulated, you're going to see a temperature rise of about 1/2 to 1 degree Fahrenheit. And so ovulation is defined as once you have seen a temp elevation of at least 0.4 degrees Fahrenheit for at least 3 days in a row, then you know that ovulation happened 3 days ago. Downside is it's not telling you till after ovulation. So my favorite use of BBT is telling you that, hey, I did in fact ovulate when I thought I did. If you are using BBT to prevent a pregnancy, you are not having intercourse until you've had 3 days of an elevated temperature. So that is a long time of your cycle to not be having intercourse. When you do that, though, you are then going to see that a perfect use, so truly abstaining until you have that temp rise, 98% effective at preventing pregnancy, but typical use is going to be closer to 93%. But both pretty good options, but going to say does take understanding and true tracking. Now, cervical mucus is another way. Now, this one's actually very free, right? You don't need any special thermometer or device. Cervical mucus monitoring, you're looking at the secretions that are at the vulva. So you don't have to be inserting your fingers deep. Some people insert just barely, but you really don't have to. You can just see what is on the vulva. And you're thinking about secretion and sensation to fully categorize mucus. You do have to internally evaluate for cervical positioning. For cervical mucus, we have 4 main categories. So type 1 is when you feel dry, so dry sensation, and there's no secretion. Type 2, you start to feel damp, but there's no secretion. Type 3, you feel damp, but now you're starting to have some thick, creamy, whiter off-whitish, maybe a little sticky. Type 4, you feel wet and slippery. Transparent mucus, stretchy mucus, elastic, consider that raw egg white. And if we're going to be real specific, you can stretch it an inch between your fingers. That's how they define it in studies. So in studies, if you have intercourse on a day with type 4 cervical mucus, you have a 29% chance of pregnancy versus a day with no mucus, so that type 1, type 2, which has a 0% chance. So when you're going to use cervical mucus, once you start to see a change in your mucus pattern, you are seeing potential fertile days. Mucus directly related to estrogen. As your estrogen level is rising, it is changing your mucus, as I used in the example at the beginning. The hypothesis here is that that stretchy elastic stuff is easier for the sperm to get through than when you have thicker mucus. So you're trying to kind of help safeguard against having sperm. Most people only have that type 4 cervical mucus for 1 or 2 days. Now, if you are trying to get pregnant, obviously that's your go day. If you're trying to prevent a pregnancy, you're going to want to avoid any potential days. The nice thing about cervical mucus is it does change as your cycle is changing. And so one of the methods that has been studied is called the billings. So you're checking your cervical mucus. Once you see a change and you start seeing mucus present, so that type 3 cervical mucus, you're going to avoid intercourse. Once you get to that type 4 cervical mucus, once it goes away, then you're going to wait 3 days. And on the 4th day, you can start having intercourse again. Because we're preventing pregnancy, we're trying to give a longer range because the outcome of pregnancy is not desirable. If you're really trying to time intercourse, you're going to hear me say day of 4 cervical mucus. So the billings does allow you to have intercourse before you see that cervical mucus change, and then once you've gotten further enough away from ovulation. Another method of cervical mucus tracking is called the 2-day method. This requires checking your cervical mucus twice a day, so morning, evening, and then seeing if you have any mucus at all that day or the day before. So if you say, I didn't have any secretions yesterday or today, that is considered a not fertile day. If I had secretions yesterday but not today, that's potentially fertile. So once you have gone 2 full days with nothing, you could say that's a non-fertile day. So essentially, any day where you had secretions yesterday or today, you are going to consider not a day to have intercourse, and you avoid those days. For the 2-day method, typical use is 86%. At preventing pregnancy, perfect use can be up to 96%. And then there is the symptothermal method, which is really important because it combines BBT and cervical mucus monitoring. And that has much higher efficacy because you're using 2 things to say these are the days I should not have intercourse. And with the symptothermal method, 98% prevention rate with typical use and 99% with perfect use. And then we have checking urinary LH tests, which are ovulation predictor tests. No LH test has been shown to be birth control. Important. Now, what you do is when you're taking an LH test to try to get pregnant, you are trying to detect that LH surge. So the first time your body has a high level of LH, and that is considered to be the day before ovulation. So if you're tracking your cycle, you want to test for LH usually between 10 a.m. to 2 p.m. because the LH surge is typically in the morning. It's got to filter and get into your urine. And you're going to want to test every day because if you miss a day, you might miss the day where your LH rose. Now, what you're trying to see is that day you have that first LH rise, that's considered surge day and ovulation's the next day. You do not need to keep testing because once you have LH surging, it is going to pulse throughout the entire luteal phase, as we said. So if we're trying to use this as a contraceptive option, the safest thing is going to be not to have intercourse or to use barrier methods until you have had your LH surge and then waited 3 days. Again, that's not proven, but then you can say, just like BBT, I'm now safely into my luteal phase and the egg is no longer around. But because it's not giving you enough pre-warning, you can't just avoid sex 5 days before that because you don't always know when that's happening. So I love OPKs for trying to get pregnant. You don't have to have a fancy, expensive one because I think it really can narrow in this day, the next day, 2 top days. Similar to cervical mucus though. So if you feel comfortable with cervical mucus, that's a free option. And some people will check LH for a few cycles. Maybe they're confirming with cervical mucus or BBT and understanding that your cycle's super consistent and you can just use a different method or one method for tracking. But if you're trying to use hormone testing to tell you when you should no longer be worried about getting pregnant, that hasn't been studied as much and isn't an official recommendation. So to me, it's more of a confirmation of the other signs you're seeing, which I love that. But understanding that really using a combination of methods is going to be the most helpful for you to really pinpoint in when are the days that you could possibly get pregnant. If you're trying to get pregnant, you're going to see that fertile window narrow. If you can have sex on the day of ovulation or the day before, since the egg only lives 24 hours, you're going to have a higher chance. If, however, you're trying to prevent pregnancy, the more consistent your cycles are with less variation, the fewer days you're going to have to avoid intercourse. When you have more variation, the only safe option is going to be barrier method / abstinence until we know for sure you have ovulated and the egg is out of your system. Otherwise, if there's variance in your cycle, I'm not sure how early, how long you can avoid. Remember, it is a myth that you can't get pregnant on your period. You can, it's way less likely. But depending on the length of time you bleed and when you ovulate in your whole cycle, you very well could. So please do not think that that's a 100% certain thing. It's not common, but it's not prevention. Now, you may have longer cycles and shorter bleed period, and for you, you may not be able to get pregnant on your period. But until you track your cycle and have a better idea of when you ovulate, you can't say that with full certainty, nor would I say that to anybody else. So if I was looking to track my cycles, I would want to know how long my cycle lengths are. I would consider looking at one of the calendar method options to start, like standard days or rhythm. Then I would add in checking temperature or cervical mucus or both in order to see if I can easily detect when I ovulate and is it consistent across cycles. Depending on how okay you are getting pregnant, you're going to feel different about the effectiveness of these options. Maybe it's family spacing between pregnancies and you don't really want to be pregnant, but it's not the end of the world. That is different than I do not want to be pregnant. So really think about your goals. When you look at these success rates, remember, perfect use is different than typical use. And if you're relying on something for perfect use, you've got to really know when you ovulate and feel really comfortable that abstinence window or the days you do not have sex do not overlap. Remember that no barrier method is 100% either. Condoms can break. Condoms alone have a 98% chance of preventing pregnancy with perfect use, but with typical use, that number is only 87%. So if you are having sex in your fertile days and using a condom, that's not full safe. Abstinence only is what will be required with perfect use. Abstinence only is what will be required with perfect use because condoms are not perfect, but not putting sperm there is. So hopefully this information helps you just understand and think about your cycles better so that you can make decisions that are better for you. I'm sure people are going to have questions. Again, tech-based options, which are super cool, going to be covered in a different episode, but ask some questions so I can answer them. You can ask questions on Instagram at nataliecrawfordmd every single Monday, or you can call and leave a message 657-229-3672. Thank you, friends. Thank you all for listening to As a Woman. It would mean so much if you could rate, review, and follow the podcast to be notified of new episodes every Sunday. I hope you learned something new, and I hope you share it with someone in your life. Be sure to follow along on Instagram at nataliecrawfordmd and check out the YouTube channel nataliecrawfordmd. If you're interested in becoming a patient, you can also follow Fora Fertility. I'm so thrilled to have you here, part of the community that amplifies others as a woman.